Hello, today we're going to do cranial nerves, and as you know there are 12 cranial nerves, and all the cranial nerves except for two have their nuclei, of them, and those nuclei, two nerves do not have nuclei, the first and the second. So let's start off with the cranial nerves. As we know that all cranial nerves which have nuclei have their nuclei in the brainstem. Now there must be a way, as we know there are three parts of the brainstem, there must be a way to divide where the nuclei should be, which nuclei, which nerve should be, at what position. So this is a brainstem. So this is the midbrain. This is the pons. And this is the medulla oblongata. I wanted to divide the nerves into four. So we give 4 to midbrain, 4 to pons, and 4 to medulla oblongata. But we do not know which 4 are in the midbrain, which 4 are in the pons, and which 4 are in the medulla oblongata. So the first 4, that is from 1 to 4, we gave it to midbrain, but there came a problem. The first and second cranial nerves do not have nuclei. So the nuclei will not be in the midbrain. So they do not have nuclei. They originate from somewhere else, which I'll tell you in a bit. Anyway, so two of the cranial nerves originate from this midbrain, that are the cranial nerve 3 and the cranial nerve 4. From the pons we have cranial nerve 5, the cranial nerve 6, the cranial nerve 7, and the cranial nerve 8. Is it right? 5, 6, 7, 8. Yes. Then from the medulla oblongata, the next 4. Cranial nerve 9, cranial nerve 10. But after that there comes the cranial nerve the 12th. The 12th cranial nerve comes after the 10th cranial nerve, and at the spinomedullary junction comes out the cranial nerve 11. Now all these cranial nerves can have any kind of attachment, so we do not need to know which nerve is attached to which aspect of the our brainstem. I'm trying to fix this so we are able to see it clearly. Yeah, so we do have the ventral aspect of the brainstem. Ventral aspect means the front or front. So from the ventral aspect, which cranial nerves originate? Cranial nerve 1, cranial nerve 2, cranial nerve 3, and after that the 1, 2, 3 we have the cranial nerve 6 and the cranial nerve 12. How do we know that? What I did over here is that to memorize it. This is not how I know it. Obviously, I know it by the dissection, but how I memorized it was, at my time, I did it like 1, 2, 3, and then I multiplied 3 with 2, and I got 6, and then I multiplied 6 with 2, and I got 12. So this is how I did the ventral aspect. Now let's talk about the dorsal aspect. That means the back side of the brainstem. What we do is, we know that there is just one cranial nerve which comes from the dorsal aspect, and that is the cranial nerve 4, the trochlear nerve. Now moving forward, we are now left with one aspect, that is the lateral aspect. From the sides, which of the cranial nerves originate from the sides? The cranial nerves that are left when you take out the fourth cranial nerve, which comes from dorsally, and the other one, the nerves which came out ventrally, which had the attachments or the nuclei at the front. So all the which is left, we'll write them down over here. So these are the cranial nerve 5, the cranial nerve 7, the cranial nerve 8, and then the cranial nerve 9, the cranial nerve 10, and the cranial nerve 11. These are the cranial nerves which are originating from the lateral aspect of the brainstem. But we do also need to know, we can just revise it from here as well, that the first 3 are originating from the pons, and these 3 are originating from the medulla oblongata. Now there comes another concept, that is the components of cranial nerves. There can be 3 components of the cranial. There are 3 components of the cranial nerve. The first is the motor, then the sensory, and then the parasympathetic. But never sympathetic. So a cranial nerve can be motor, sensory, parasympathetic, the 2 of them or the 3 of them, but it can never be sympathetic. It is never sympathetic. The next point is that you need to remember, which I've already said, that every cranial nerve has at least one component, and the maximum it can have 3 components. About these components, let's know more. About these components, the pure sensory nerves out of the 12 nerves, the pure sensory nerves, These nerves will not have the motor fibers in them. This will just be sensory. These are just 3 nerves, and just remember them by 1, 2, and 8. So this is the first cranial nerve, second cranial nerve, and the 8th cranial nerve. There was one point that I missed when we talked about the ventral attachment. Let's just move back to the ventral attachment over here. These two nerves, the first and the second, we should know that this cranial nerve 1 and 2, they have their ventral attachments to the cerebrum. So write it down in your notes as well, so you remember this. This is important. Now moving back to where we were, we have 3 pure sensory nerves, that are the cranial nerve 1, the cranial nerve 2, and the cranial nerve 8th cranial nerve. So let's move on to the pure motor nerves. So the pure motor nerves, you also have to remember these. The pure motor nerves are 3, 4, 6, 11, and 12 are the pure motor nerves. You can use the Roman writing, which is preferable, but I'm just writing it because this is how it's easier to remember. And yeah, so these are the pure motor nerves, and these are 5 in number. So let's move forward. The next we have are the pure mixed cranial nerves. So what does mixed cranial nerves mean? Mixed cranial nerves have both components. This means that they are motor as well as sensory. So mixed cranial nerves are cranial nerve 5, 7, 9, and 10. So you remember these 5, 7, 9, 10. I actually memorized it. Anyways, so yeah, we're moving forward to the parasympathetic nerves. And these are the 3, 7, 9, 10. So from here, you can notice one thing, that the mixed cranial nerves, 3 of the mixed cranial nerves that are 7, 9, and 10 are also parasympathetic. There is 7, 9, and 10, but 3 is not a mixed nerve. It is parasympathetic, and out of the motor and the sensory, it is motor. It is purely motor. About the 5th cranial nerve, it is mixed. So yeah, and the rest of the 3 are mixed and also parasympathetic. So you remember this by this as well. Now what you need to know are the nuclei of the cranial nerves. Separately, we'll study the nuclei separately of each cranial nerve. So now let's start with the nuclei of the cranial nerves. So the first cranial nerve and the second cranial nerve is what we're going to discuss first. So the first cranial nerve, there is no nucleus. And the second also does not have any nucleus. So now let's talk about the third cranial nerve. The third cranial nerve has two nuclei. And these nuclei, one of them is motor and the other is parasympathetic. The parasympathetic nucleus of the third cranial nerve is called the Edinger-Westphal nucleus. This is a very important nucleus, and this was why my Viva question when I was at this stage. So this is a very important one. If you want to see why this is a motor and parasympathetic nucleus, you can see evidence from here. Let me show you. We see that there is the motor nucleus over here. It is a pure motor nerve, and it's also a parasympathetic nerve. So this gives us evidence that it is the pure motor nerve from the, like, if you want to relate, it's not evidence for the science, but it's evidence for you to remember. So yeah, you remembered that it was a pure motor nerve, and then you remembered that it was a parasympathetic nerve. And you can write it down over here as well, that the parasympathetic nucleus of the third cranial nerve is called the Edinger-Westphal nucleus, because that is an important question. Anyways, moving forward. The fourth cranial nerve is a pure motor nerve, and it has just one nucleus. Let's relate again. This is the fourth cranial nerve. It's a pure motor nerve. There is nowhere else that it is. So it's a pure motor nerve, and it comes there. Anyways, so moving forward, the fifth cranial nerve, which is a very important nerve. So it is present. All the nerves are important, but this one, yeah. Anyway, so the present at the lateral aspect pons. So there are two types of nuclei, two types of nuclei. One of them is motor type and the other is a sensory. Why did I put it here? Take the evidence from behind. It's here. Behind the page, I meant. Anyway, so over here, maybe you have it on the same page so you can relate it easily. Over here, see, it's a mixed nerve, so it will have the sensory and the motor component, and it's not a parasympathetic nerve, so it will not have a parasympathetic component. So about the motor part, it has one motor nucleus, and that nucleus is actually called the motor nucleus. So about the sensory nucleus, it has three sensory nuclei. So the three sensory nuclei that it has are, number one, the mesencephalic, nucleus, number two, main sensory nucleus, and the third is the spinal nucleus. Now, with the help of a diagram, I'd like to show you how this is the brainstem, this is the divisions, this over here is the motor nucleus, and at its side we have the sensory nucleus, the main sensory nucleus. Then we have the spinal nucleus going down towards the spine. And over here, the spinal nucleus, if it's visible, ends at the C5 cervical segment. And this is a spinal nucleus. And the red one that I drew is the main sensory nucleus. So if you draw another line that is with another color over here, I need another color, yes, this one maybe. So if I draw, this is going up like this halfway somewhere, I am not sure though, yeah, like this. Anyways, yeah, I drew it a bit wrong. So it's in the pons, it's going towards the pons. This is the mesencephalic nucleus of the fifth cranial nerve. So this is how the fifth cranial nerve nucleus are done. Now we'll do the sixth cranial nerve. So now we're doing the sixth cranial nerve, which is the abducens nerve, and this is the pure motor nerve. And we know this because of this. This is the pure motor nerve. When wrote it down in the pure motor section, we can relate again. And there is nowhere else. It's not the mixed nerve, it's not a parasympathetic nerve as well. So the pure motor nerve it is. It has one nucleus. It is present in pons. And this nucleus that it has, the motor nucleus that it has a name. And that name is the parapontine reticular formation. It is also called subcortical gaze center. Let's write that down too. I'll just write it down the same color. Subcortical gaze center. So damage to this nucleus will inhibit left lateral and right lateral conjugate gaze. So this is one important information about the nucleus of the sixth cranial nerve. Now we have the next cranial nerve, that is the seventh cranial nerve. The seventh cranial nerve has three nuclei. These nuclei, as we know from the previous knowledge, that it has pure motor and then it has the parasympathetic component as well. Pure motor and parasympathetic component. So it will have that. And it does not have the sensory component, but it has the pure motor. It's not the third cranial nerve, I'm sorry. The seventh cranial nerve is a mixed nerve. We're talking about the seventh cranial nerve, so it is a mixed nerve, and it does have this parasympathetic component. I was so wrong there. Anyway, so I'm correcting it again. That the seventh cranial nerve is a mixed cranial nerve, and it has a parasympathetic component as well. So it has sensory, motor, and parasympathetic components. Three components. Let's write it down. Sensory, motor, parasympathetic components that it have. So the sensory nucleus that it has is the special sensory nucleus. It is a special sensory nucleus, and this nucleus is called Tractus Solitarius. The Tractus Solitarius is a special sensory nucleus of the seventh cranial nerve, the facial nerve. Let's talk about this special nucleus before proceeding forward. Nucleus Tractus Solitarius has three parts. Also, know about it. I'm not writing it down, but you should know that and you should write it down in your notes, that the Tractus Solitarius perceives the sensation of taste. So it is a nucleus of this is the nucleus of three cranial nerves. So which three cranial nerves are these, which this is a part of, or the nucleus of? The cranial nerve 7, the cranial nerve 9, and the cranial nerve 10. This nucleus is a part of these three cranial nerves. Let's make the midbrain again, like this. So where will the 7, 9, and 10? This is not just it's a brainstem. I made them brainstem. I'm sorry. Okay. So we know that the 7th cranial nerve will be over here in the pons, and the 9th and the 10th cranial nerve will be in the medulla oblongata. So we'll draw it like that. So this is the Tractus Solitarius nucleus. This part is in the 7th cranial nerve. The pink part is of the 9th cranial nerve. And this part is of the cranial nerve 10. So yeah, anyways, now anterior 2/3 of the tongue sensations because this is the nucleus that perceives the taste, so we'll find out like how it does it and what it does. So the anterior 2/3 of the tongue's taste sensations are carried by the 7th cranial nerve. So the first part, the part that is in pons, will carry the sensations. So the sensations, the taste sensations from the anterior 2/3 of the tongue are carried by the 7th cranial nerve. Posterior 1/3 of tongue's taste sensations are carried by the cranial nerve 9, that is the glossopharyngeal nerve, and the posterior pharyngeal wall. The posterior pharyngeal wall's taste sensations are carried by the 10th cranial nerve, that is the vagus nerve. Now the nucleus, the parasympathetic nucleus. Let's talk about the parasympathetic nucleus of this nerve. I made a video while writing this down, but it wasn't recorded, so I'm going to do it like this. So the parasympathetic nucleus has 4 parts. This is where I drew the parasympathetic nucleus over here. This is a finger-like nucleus. It has 4 parts. The blue part that is at the top in the pons, it is a lacrimatory nucleus. It is the nucleus that causes lacrimation, and this is the part of the 7th cranial nerve. The other part of the 7th cranial nerve of this parasympathetic nucleus is the superior salivatory nucleus. The superior salivatory nucleus will obviously cause salivation, and this is the part of the 7th cranial nerve. Now we have the inferior salivatory nucleus, which is the pink one, and it is a part of the 9th cranial nerve. Now if you look at it properly, the last part over here, this one, is the dorsal vagal nucleus, and this is of the 10th cranial nerve. Now let's move forward to the vestibulocochlear nerve, which is the 8th cranial nerve. This is the only cranial nerve which has 6 nuclei. It has 2 components. Vestibular component and cochlear component. In the cochlear component, we have two nucleus and nuclei, and in the vestibular component, we have 4 nuclei. So let's see. In the it has 2 nuclei, and what are the names of those 2 nuclei? It's the anterior cochlear nucleus. It's so simple. And the posterior cochlear nucleus. So anterior and posterior are done. Now let's move to the vestibular component. Now what's left? The superior vestibular, sorry, it's not the component, it's the nucleus. So the superior vestibular nucleus, inferior vestibular nucleus. These are so easy. Then we have the medial vestibular component, and then the lateral vestibular component. It's just covering all the aspects, these components, these nuclei. These are the nucleus. The lateral, I'll repeat: superior vestibular nucleus, inferior vestibular nucleus, medial vestibular nucleus, lateral vestibular nucleus, then the anterior cochlear nucleus and the posterior cochlear nucleus. These are the 8 nuclei of the 6 nuclei of the 8th cranial nerve. So now the next cranial nerve that we're going to do is the 9th cranial nerve. It has 3 components. Refer to your previous notes. Sensory, motor, and parasympathetic. So let's discuss the sensory first. It is the 10th cranial nerve is a glossopharyngeal nerve. The second sensory nucleus is Tractus Solitarius, and this is what we have discussed already. The motor nucleus is nucleus ambiguous. It supplies, the nucleus ambiguous supplies the muscles involved in speech. Let's write it down. In speech through cranial nerve 9, 10, and 11. Now the parasympathetic nucleus is the inferior salivatory nucleus, as we have discussed earlier. This nucleus, the inferior salivatory nucleus, will supply or supplies the parotid gland through this nerve, which is the glossopharyngeal nerve, through cranial nerve 9, that is the glossopharyngeal nerve. Now there's a note that you should write down. Note it down that the submandibular and sublingual salivary glands submandibular and sublingual salivary glands are supplied by superior salivatory nucleus through facial nerve. And if you don't know which facial nerve, what facial nerve is, that is the seventh cranial nerve, and you should know the names of the cranial nerve. That's important. Let's move on to the next cranial nerve. And that is the 10th cranial nerve. This is the vagus nerve, if you don't know already. Vagus nerve has three components. It is a mixed nerve and it is also parasympathetic. It is sensory, motor, and parasympathetic. Sensory, it has a special sensory nucleus, that is the Tractus Solitarius. The motor nucleus is the nucleus ambiguus. And the parasympathetic nucleus is the dorsal vagal nucleus. We have done this as well. So some things about this one. The nucleus ambiguus, we know that this nucleus supplies the muscles involved in speech. Dorsal vagal nucleus supplies the foregut and the midgut. And it also supplies the hindgut plus the pelvic viscera of the females and the males, and the nervi engine type, the pelvic splenic nerve, are parasympathetic nerve. So this is not important. It is important to some extent, and but if we're just doing the nuclei, so that's why I'm not writing it down over here or explaining it or going into any detail about it. So about the Tractus Solitarius, we've done a lot of detail already. Let's move forward to the 11th cranial nerve. The 11th cranial nerve is called the accessory nerve. The accessory nerve, it has two components. Spinal cervical component and cranial component. So the cranial component from first, the spinal cervical component is from the first 5 cervical spinal segments, and the cranial component of the accessory nerve is the motor component. So you know that this is a motor nerve. What is the name of that motor nucleus? Is the nucleus ambiguus. And this nucleus supplies the muscles involved in speech. Now there's just one cranial nerve left, and I know it's getting very boring, but this is what you need to remember. Make notes. I have made them in the very interesting way as I could, and this is just the first part of this cranial nerves chapter. Not just the cranial nerve lectures that I prepared. This is just the first part. The second part will be done separately. So the cranial nerve, 12th cranial nerve, that is the hypoglossal cranial nerve. So from the glossal part, you know that this is related to the tongue. So it has only one component, and that is a motor component. Other than that, this is attached to the ventral aspect of the medulla oblongata, and it supplies the muscles of the tongue that we know from the glossal part. So the motor component, it has one nucleus, and that luckily that nucleus is named nucleus of the hypoglossal nerve. Nucleus of hypoglossal nerve. It is present in the medulla oblongata, and this hypoglossal nerve leaves the skull through the hypoglossal canal. So when we did the base of the skull, we remember that the floor of the skull, I think, yeah, the floor of the skull, we did the hypoglossal canal. So that is where it comes out from the skull. So this is it for the first part of the cranial nerves. We'll do the rest in the next part. There'll be just two parts of this cranial nerves. Don't forget to subscribe, and don't forget to thumbs up the video if you like, and for any queries, post the queries in the comments. I hope that it be helpful for you.